Hi, my dear friends. I am Dr. Yusuf Chunawala. I am basically a pediatric dentist. I have done my master's, that is MDS, in pediatric and preventive dentistry. I am basically a child specialist dentist. Now, many a times, many of our patients come, and they generally come when they are in severe pain, of course, and they ask me a very common question. After going through so much of treatment and all that, a simple question they always put up: okay, when should be the child's first dental visit? When should I bring my child at the earliest? Now, when you go through various search engines, they say you should bring the child at 6 months. Then some say that you should bring when they are maybe 1 year old. Some say when the first tooth erupts in the oral cavity. So what is the real answer to that? Now, generally, I'm telling you, in majority of places, they bring the kids when there is pain. But do you think that they bring the child to the dental clinic immediately when the child complains of pain or when they see a black spot? No, no, my dear friends. What happens, see, whenever a child has pain, the first remedy or the first painkiller is provided by the mother. Okay, because the mother will give some medications to the child and he'll be all right. And then comes when there is a second episode of pain, again maybe the mother gives the pain, or then the mother-in-law or some friend's suggestion comes in, no, you give this medicine, this works very nicely. Now is the third aspect. In the third stage, what happens now? What has happened? The parent is like unable to sleep for 2 nights because the child is in severe pain. So that's the time they bring the child to the dentist. Okay, so majority of people bring their kids to the dentist when there is pain. So my question is, when should be the first dental visit? According to me, the first dental visit should be when the lady is pregnant. You might wonder, Are, but there are no teeth which are there at that time. How can you? But it makes a difference. The first thing is that the mother should visit a dentist, and especially a pediatric dentist. Okay, and she should get a little bit of idea of how she has to manage her child. So the first step is that the mother should get her own treatment done properly. Her own dental health should be taken care of, and then the pediatric dentist will discuss with her how she has to take care of her child. Brushing does not begin. Brushing does not begin like when the teeth erupt in the oral cavity. When the child is born, believe me, he doesn't have any dental caries causing bacteria. And one thing I'll tell you, my dear friends, that dental caries is such a disease which doesn't come from heredity. Heredity means what? My father had it, my grandfather had it, my great grandfather had it. No, it doesn't pass on that way. It is purely an environmental thing, and it is purely preventable. It is not that if your father had it, you will have it. It is purely preventable. Now, what happens is the pediatric dentist will teach the mother, okay, when the newborn is born, and the child is on breastfeeding, what needs to be done, how the hygiene has to be taken care of. Then when the first tooth erupts, what is to be done. Then finally, even because many kids land up with something called as nursing caries. They develop dental caries because of the breastfeeding or because of bottle feeding also. So all these little facts are explained by the dentist to her. Now the next step comes that how and when, even for example, if you have to use a toothpaste, when to use the toothpaste, which brush to use, the parent may be aware, may not be aware. So the whole concept has to be taught. And generally what happens, these things are never taught to us, not so easily. And only the educated few or people from the developed nations where this is a common norm, people are doing it that way. But in countries where this is not happening, a lot of awareness has to be created. Now, the best way to create awareness is to visit a pediatric dentist when you are pregnant. Now, in my next video, I'm going to discuss all the basic care that has to be taken by the pregnant lady, okay, during her pregnancy, then what all she has to do when the child is born, okay, and in the various years and the initial years of life, how do you maintain the oral hygiene, what kind of toothpaste to use, what kind of brushes to be used, what kind of mouthwashes. All this will be discussed in detail in my next video. I would be greatly obliged if you can subscribe to my channel. Please do view it, like it, and share it amongst your friends. And I'll be back soon with my next video. Thank you so much.